Thank you for watching this informational video about nuchal translucency assessments, a specialised pregnancy ultrasound. Throughout your pregnancy, you may be referred to us for a number of scans. The most common scans are an early pregnancy scan, which is performed before 12 weeks, a nuchal translucency assessment, an 18 to 20-week scan, also called a morphology scan, and a third trimester scan. This video will focus on the nuchal translucency assessment and, in particular, what it is, what to expect when you have your scan, what it can tell you and your doctor, and how it may assist you during your pregnancy. The nuchal translucency assessment is a specialised scan not everyone will want to have. It is offered to women who have made the decision to find out if their baby is at a higher risk of being born with any chromosomal anomalies, such as Down syndrome. In any pregnancy, there is always a risk of a chromosomal abnormality, and this risk increases with the mother's age. Down syndrome, or trisomy 21, the most common chromosomal abnormality, has traditionally been difficult to detect before birth. However, the result of a nuchal translucency assessment can now suggest if your pregnancy is high risk or low risk. All developing babies have a layer of fluid on the back of their bodies, between the skin and the underlying soft tissue. This layer appears translucent, which means you can see through it when using ultrasound. When this layer is measured at the back of the baby's neck, it is called the nuchal translucency measurement. Studies of more than 100,000 pregnancies have shown that in pregnancies where there is an increased thickness of the nuchal translucency, there is an associated increased risk of chromosomal abnormalities. The nuchal scan is a highly specialised scan, and its requirements are quite specific. A nuchal translucency assessment can only be performed during a very short window of your pregnancy, that is between 11 weeks 3 days and 13 weeks 6 days. Because the scan is only performed at a small number of specialised imaging centres, there can be a longer wait time for appointments when compared with other pregnancy scans. We recommend you discuss this scan with your doctor early in your pregnancy and book a scan in early to ensure you are able to make an appointment during this small diagnostic window. The ultrasound is performed in conjunction with a blood test. While the ultrasound component alone detects approximately 75% of chromosomally abnormal pregnancies, when performed in conjunction with the blood test and nasal bone measurement, this can be increased to 90%. So before you have your scan, you and your doctor will need to organise a blood test. The blood test is best performed after 10 weeks and should be at least 3 working days prior to your scan to ensure we have the results to look at alongside your scan results. All early pregnancy scans involve the standard technique of scanning across the abdomen and pelvis with a full bladder. This kind of scan is called a transabdominal scan. For the large majority of patients, the nuchal assessment is a transabdominal scan, but in a small percentage, a scan may need to be performed internally or transvaginally. Most women empty their bladder before this scan and do not experience any discomfort. After combining the nuchal translucency measurement with your age and the blood test results, we use a specially designed computer program to calculate the risk of your baby having a chromosomal abnormality. The risk of this outcome is categorised as 1 in more than 500. If you have a result of less than 300, you're a high risk. More than 300 and you're considered low risk. The level of comfort with the results will vary from patient to patient. If the nuchal translucency assessment determines your baby is at an increased risk of chromosomal abnormality, you should discuss this result with your referring doctor. This does not mean your baby is abnormal, but indicates further tests may be needed. Most high-risk pregnancies will be normal. Your doctor will be able to provide advice about further testing such as amniocentesis. Whether or not you should have this scan performed is a question for each parent to answer for themselves, and we recommend discussing the study in detail with your doctor. The main reason for performing this test is to detect chromosomal abnormalities and to give consideration to further testing or possible termination of pregnancy if an abnormality is found. Women who are most likely to benefit from this test are women who are over 35 years of age, as the risk of chromosomal abnormalities increase with the mother's age, women who have previously had an abnormal pregnancy, or women with a family history of abnormal pregnancies. If you had this scan, you will still need a morphology scan at 18 to 20 weeks to assess your pregnancy in full. We have an information video which explains the other ultrasounds you may have throughout your pregnancy. Having a baby is an exciting time, but it can also be expensive. We're often asked about the costs of the scans and Medicare rebates. Because this is such a specialised and important scan, we focus on providing specially qualified and highly experienced sonographers who can offer a high-quality service. We may offer some concessions in special circumstances, so please ask our staff when booking. When we confirm your appointment, we will let you know exactly how much your scan will cost and what amount can be claimed back from Medicare. You may be eligible for a rebate if there are certain clinical indications which your doctor will be aware of and will note on the referral, things like a history of high-risk pregnancies, or if you will be over the age of 35 at the time of birth. But in many cases, patients are not eligible for a rebate for a nuchal translucency scan, and a private fee will apply. We carry out reliable, routine pregnancy scanning at all of our practices. But because babies and pregnancies are not always routine, we offer an additional specialised service at our women's diagnostic centres in Brisbane. These centres are located at the Mater South Brisbane and Sunnybank private hospitals, and we also have an obstetric imaging centre at Greenslopes Private Hospital. In regional areas, we offer specialised women's imaging services at our hospital sites. Please contact your local team for more information. These dedicated professional and sensitive services can offer extra peace of mind for you when you are preparing for your very special arrival. We hope this video has helped explain what to expect when having ultrasounds during your pregnancy. If you have any questions about your scans, please contact your nearest Queensland X-Ray practice or ask your sonographer when you arrive for your scan.